Thank you so much for joining us today for the NEMSIS TAC Public Training Webinar. Today is Thursday, August 16, 2018, and the title of the presentation today, as you can see, is EMS Agency Introduction to the NEMSIS Version 3 Performance Measure API. Today our presenter is Dr. Clay Mann, who is the Principal Investigator of the NEMSIS Technical Assistance Center. And without delay, I'll go ahead and turn the time over to Clay.
Thank you, Monet, and good morning, folks. Thanks for joining us. I'm really excited to talk to you about this topic, but particularly, this is a project that we have been working on probably for over a year, so we're excited to see it really come near completion and make it available at the end of this year for hopefully implementation early next year. This is a tool that will originate from the NEMSIS Technical Assistance Center that will provide for a mechanism for local EMS agents to actually benchmark their performance through their software. So the value of this presentation for folks who are working in EMS agencies is to get a good feel for what you can expect to see available to your software companies at the end of this year, hopefully for implementation in their software early in 2019, and for the states to also get a feel for what will be available for their agencies, and will help them to be able to ensure that they're using it to its maximum benefit. So let's talk a little bit about this exciting new tool. To do so, I'm gonna try to paint a picture, because describing the real value of this tool really requires a story be told. So here are the objectives for this session. We're going to talk about just some important attributes of the NEMSIS standard. This will be a bit redundant for folks who are familiar with NEMSIS, but important just to have these concepts in our mind. What are the associated advantages with this moving to version 3? This product is really only possible because of our move to version 3. I'm going to provide kind of an application example using a performance measure that was developed out of the Compass project that wrapped up last year. Also going to talk about the importance of data quality, right? Really looking at performance at an agency level, state level, or national level is really only as good as the data quality. But I have to tell you, though, it's probably hard for the country to perceive yet, because we're just rolling out version 3 data for the first time this year. Data quality is incredibly improved with version 3 over version 2, and we'll talk about that a little bit. And then I want to introduce to you the V3 Performance API measure. I think with the background, it will really make it much easier to understand the value of this tool. So let's just dig right in. So just a couple of important attributes of the NEMSIS process, the NEMSIS standard. It is an information system. First off, we seek a complete census of records, right? So NEMSIS does not rely on a probability sample collection of EMS agencies across the nation that are weighted to represent other agencies. We are requesting data from the entire country. And under version 2, at its peak, we were collecting 30 million EMS activations from 49 states and territories. With version 3 as of yesterday, because New Hampshire actually started submitting yesterday, we're now collecting from 35 states and have about 14 million EMS activations so far this year. So we'll probably get close to 20 million this year. Great progress. We'll talk about that a little bit. We test all of the products that are used within states for compliance to the NEMSIS standard. So the field products as well as the state aggregation products. They all have to exchange data in a structured way, so that a field product completes a record in a patient's living room, it goes to the state, and then it comes to the national registry. We all complete the same data collection. There are national elements that every provider across the country collects, and then there are state-specific elements, and then some elements that are specific to agencies. But this allows us to aggregate data at a much higher level at the national level, and that's what makes this API possible. Let's talk a little bit about the value and the challenges associated with NEMSIS, just to give you a feel for the data coming in and the quality of the data. Version 3 attempted to clearly improve data quality by having a standard set of business rules that every EMS provider, when they complete a record, there's a set of validity rules that checks for pregnant males and for other data mishaps in the record to ensure that it's correct. We also now provide pertinent negatives. We'll talk a little bit about that. I'm going to be talking about the performance assessment, so this presentation speaks specifically to that advantage. We've improved the data transfer. It's automated now, so the data comes in much quicker. And maybe one of our most important challenges is we wanted to make NEMSIS a nationally approved standard. To do that, we had to use national standards for clinical content. We'll talk about that a little bit. So here's just an example of the first one I mentioned, the data quality is improved by pertinent negatives, right? So this truly helps us. You can see in the middle of this page that we list the pertinent negatives that are available for medications given to a patient. So now you can truly indicate, a provider can truly indicate why they did not give a medication. That helps us to improve the ability to look at protocols and adherence to protocols. Before, under version 2, if something was left blank, we didn't know if the provider just forgot to give the medication or if there was a good reason why they did not give the medication, for example. So pertinent negatives have helped us increase the quality of the data and allowing us to look at performance. Data exchange is automated. So this has been incredibly valuable in that now data is flowing from the field to the state to the national level very quickly. So last year, while version 2 was mostly being collected, we collected 29 million EMS activations from almost 10,000 agencies, as you see here. Nebraska and a couple of forward-thinking states had already moved to version 3. At that time, we were collecting data from the time that a record was closed in the living room of some home in Nebraska until the time it passed through the state repository and into the national registry was on average 7 minutes. That was incredible. Now we're receiving nearly 150,000 records per day. That time is not as quick. It's about 24 hours now. But the fact that it's 24 hours is okay, right? Because we're building up our processes to allow us to receive the data more quickly. We'll get down to a very quick turnaround on the data. This is incredible because it allows us to look across the entire nation. What happened, for example, 7 minutes ago across the country. So really an incredible value with version 3. Now here are those healthcare standards that we're having to abide now to that contain the clinical content that's in version 3 of NEMSIS. These standards, ICD-10, SNOMED, RxNorm, you can see what elements these standards are used for. These are clearly clunky at best for a pre-hospital setting. ICD-10 CM does a great job of providing diagnosis codes, but for us, we rely on impressions and symptoms, much harder to kind of properly assess those using ICD-10. But it is the standard that we use in this country, so we're doing our best to adhere to it. Well, now that we talked about the benefits associated with version 3, some of the challenges, let me give you an example of how we're now going to be able to use that version 3 data to provide strong benchmarking information for our local agencies in regards to the work that they do. So let's take an example performance measure, one that was developed by the Compass Project that ended last year, and it's slated to be revived. They came up with a measure related to stroke. It was called stroke number 3. The measure was basically, here in the first line, what is the percent of stroke patients in your agencies for a certain time period that received a stroke severity assessment, right? So try to think about how this is framed up, right? So the numerator has to be, well, the number of patients who actually had a stroke score documented, And then the denominator needs to be all patients where providers thought there might be a stroke, that the patient may have suffered a stroke. So there are several different ways to potentially collect it in NEMSIS, right? It could be could be identified through a protocol, right? So eProtocol 01 has a protocol for medical stroke or TIA. It could be a symptom, such as a facial droop, or it could be an impression, which would actually be a stroke code, right? And in ICD-10, stroke codes are represented by the code I63, as you can see here down towards the bottom. But let me give you an idea why that's not so clear-cut, right? So if you actually go to ICD-10 and look for I63, there's literally hundreds of codes that represent a stroke, a cerebral infarction. And of course, ICD-10 is built to identify exactly where that infarct occurred, so you have, different thromboses in different arteries, clearly important diagnostic codes based on laboratory findings and kind of X-ray findings. For us, we just need to be able to identify that we feel like there's an impression that this patient has a stroke. So we rely on suggested lists. So we choose which code out of this I63 we feel like EMS should probably use, and then we've listed it here in the suggested list for impressions to cut down the number of codes that our providers need to look through. So we suggest that the software products use I63.9, which is cerebral infarction unspecified, as the code used across the country to identify a patient who has potentially suffered a stroke. So that's just a good feel for how the measure would be developed, right? So if you truly wanted to capture in your agency the percent of stroke patients, those patients where your providers thought that a patient may have suffered a stroke, how many of those received a stroke severity assessment? Well, so that's an incredibly important value for you to be able to look at within your agency. But say you come up with a number. Say you come up with a number 87% or 88%. That's valuable, and you can work to improve that percentage. But how do you compare to other agencies across the country, right? Are you doing, is 87% really good, or is 87% average? Where are like agencies across the country? What's their percentage? So that's what the Performance API does. But before I show you that, let me just talk about data quality a little bit. So what I'm showing you here is a data quality report that all of the states have access and allows them to look at the quality of the data that's occurring in their state. Now, I've opened it up with the national view, so you can see the states that are submitting data under version 3. You can see by county and by zip code those patient care reports that are submitted that have a warning associated with them. So there are over 400 business rules, validity rules, like are you recording a pregnant male, for example, that has logic that's built into now the software based on NEMSIS compliance. And you can see here for sometime in April, I took a snapshot in April, and you can see the records here that are in green that came in with no warnings whatsoever, and the records in yellow or orange are those that came in with at least one warning. So a warning might be, it looks like maybe your times may be reversed, right? You may have recorded some elapsed times that are in a wrong order. They're warnings because we want the providers to look back and make sure that they have not made an error, that the issue is correct. Warnings are present because there are these absolute rarities that can occur where the logic can be correct, and so it's called a warning instead of an error. So this report for a state indicates like what time of day these errors are happening in their state. Here's an indication of when the record's coming in. Remember I mentioned that it was 7 minutes between the time of a close of a record until arrival at the National Repository. Now you can see states are coming on board with version 3, so they're submitting old data to us. So right now these lag times look extended, but as soon as we get all the states on and they're all caught up in their data, this will become a true representation for each state of how quickly their records are being received. And then within the state, they can look at which of the elements that are in NEMSIS are causing the most trouble. Which one are they having difficulty collecting? They can look by agency to see which agencies are throwing the most warnings, right? So each of these represent an agency, and it's the average number of warnings per patient care report. This is a national report, so these 15 really represent out of the 2,500 agencies we're currently collecting information from. These are the about 15 worst eggs, right? So, but within a state, they could look very quickly and see who's having the most trouble kind of collecting data. And if I could scroll down through this, if this was actually the report and I could scroll down, you would see that this exponentially drops off very, very quickly. 93% of all agencies have less than one warning per record. So we are doing really, really well in our data collection. Here they can also look at which business rule is the one that's most commonly violated, so which warning. And then they can also look within an agency and see which software package is producing the most warnings, right? So maybe a state can say, hey, wow, this particular software, we look like yours is throwing a lot of warnings compared to others being used in our state. Can we talk about that? So to sum that piece up, really the fact that 93% of our agencies have less than one warning per record is just an amazing improvement in quality. And by the end of this month, we will release our first full year of version 3 data. It'll have 8 million records in it for 2017. And we're cleaning that now. And I can just tell you as we go through that on a daily basis, it is much improved data. So with that background, let's talk about the NEMSIS Performance Measure API. So think about the frequency with which data is submitted, the quality of the data. We're now at a place with version 3 where we can actually provide back valuable reports to our agencies with quality data quickly, right? So let me lay out for you the idea of the Performance Measure API, and then we can talk about its value. So the NEMSIS Performance Measure API is basically a data set that sits behind a process that allows a EMS software agency to call in to that data set. So if you are, for example, an agency in California, and let's say you wanted to look at that very compass measure for your agency that we just talked about, so the percentage of thought to be stroke patients who received a stroke scale score, you could submit that request to look at that quality metrics to your software, whether you're using Zoll, Beyond Lucid, Image Trend, any product, and it would provide you, that software can call into this API and get the answer to that performance measure for like agencies that exist in your state, in this case California, and can also give you the answer to that performance question for all agencies in the entire nation for that very question, right? So if you ask that question and we mentioned it comes back as 87% for your agency, and you look and discover that the average for California is 85%, and the average across the country is 84%. That gives you a feel for how well your agency is performing compared to like agencies across the country. Well, how does this performance measure actually provide data for like agencies like you in California in this example, and across the country? Well, this API, when you set up your software in your product you're using in your state, whether it be Zoll, whatever the product, you answer some basic questions related to NEMSIS that really define your agency, right? So you record the zip code that you live in, and we use urban influence codes to assign you an urbanicity, rural, frontier, urban. You indicate your organizational status. Are you volunteer? Are you paid? What is your type? Are you for-profit, governmental? Lots of options here. Which census region do you live in? What's your agency volume? Of course, what calendar year you're currently in, and then the level of care that you offer in your agency. So we use these measures that's all from data already collected in your software to find these values, the state value and the national value, on like agencies that meet these same criteria across your state or across the nation. Right, so things like agency volume is kind of broken out by 10,000 so that we can do matching. But you can see that we come up with a pretty good method to match your agency, the type of patients that you potentially see, the type of care that you offer, and allow you a good, strong, valuable benchmark for every performance measure that your software supports by having this ability to call into this API. So that is really the value of the API and what the API does. So we're in the process of finishing up the API this month for these first 3 performance measures that were developed by the EMS Compass project. So for patients with injuries, was pain assessed, blood glucose evaluation, and then for suspected strokes receiving a pre-hospital stroke scale. That's one that we just talked about a moment ago, and I apologize, this should be stroke 03. But these 3 performance measures will be released this month. We'll be talking with all the vendors actually next Monday at a conference that we're having showing them how to access this API, how to use this API, and then we're hopeful that the software products early in 2019 will be able to implement the ability to call into the API and provide benchmark data for your agencies. I'll just mention here that the system is built so that we can cut and paste additional performance measures into the chassis of the API very easily. So if there are measures that you would like to see kind of assessed within your state or at your agency, you can certainly let your state representatives know, or us here at the NEMSIS TAC, and we'll evaluate whether or not it is actually a performance measure that we could provide in the API. We'd love to do that. So that's a quick overview of the API. So the value of the API is, I think, good quality data going into the measures, into these benchmark measures. The rapidity with which data is submitted to us, I think it will be truly possible early in 2019 for an EMS agency to call in every Monday morning, request the benchmark data for their agency from the prior week, right? So you'll be able to look at how often injured patients received pain assessment for your agency last week and be able to compare last week the benchmark from your state and the benchmark from the entire nation. So the real value of us receiving data so quickly is going to be incredibly valuable. Well, of course, we can only provide this data as states move to version 3, and so I just wanted to give you a quick update as to where we are in regards to the states that are currently submitting for version 3. Those that appear here in green are submitting data to the National Registry, and we'll be able to provide back benchmark data. Now, not all agencies within all of these states are submitting, right? We turn a state green as they begin the process. So New Hampshire, that just came on yesterday, they have only 6 agencies that began submitting yesterday, but that will grow exponentially and will really help us to have good quality data to provide in these benchmarks. So if your state is not green here, we continue to work with them, and I know that all these states are working very hard to turn green. And once they are green, we'll be able to provide those benchmark data. How quickly are states coming on to version 3? We built this little figure, and I just thought it might be valuable to show it just real quickly. So on the y-axis here would be all states and territories within the United States. And then the x-axis is number of years that have passed since the release of a NEMSIS standard. So if you look at the blue line, this represents how quickly states came on after the release of version 2. So you can see we released it the first year within no states came on the first year. Within 2 years, 3 states had come on, and you can track the progress up until which we really ended with 49 states and territories. So years 12 and 13 really did not occur because we moved away from version 2 to version 3. Then the red line, the lighter pink line, was a projection. We asked all the state data managers when they thought they'd be able to make the move to version 3, and you can see that there was this real quick uptick, right? They thought that they would be able to, most states could move by, 5 years after release of the standard, 6 years. Well, we're right now at 5 years past the release of version 3, and you can see that as of right today, with New Hampshire coming on, we have 35 states and territories. So we're tracking to really bring on states into version 3 much quicker than we did with the version 2 standard. So this is all really, really positive news. Then I'll just mention real quickly, just in conclusion, folks may know that we are moving to a new version of the NEMSIS standard. It will be version 3.5.0. It really will be rolled out over a 5-year period, and you can see it listed here. We're just now finishing up the request. They were finalized in May. We're meeting next week with vendors to clean up a couple of small issues that still remain. And then a candidate release will not be available until May of 2019. Candidate release means that it's just a preliminary release that's given to vendors for them to try to break it, play with it, and then report back information for us so that we can fix it. So the final release is really in September of 2019. We begin to test vendors for compliance to the standard, and you can see that we hope that the software will be released in early of 2021, and that the majority of the country will have moved by January of 2022. So we're beginning this process again. It's spread out so that we can do it in a very controlled and facilitating manner that really removes a lot of the bottlenecks that may occur by trying to do something so quickly. So that is a real brief overview of what the API is going to look like that comes out this week, what you can expect to see in your software in 2019, how it will match state or national data to like agencies to yours, and the initial 3 measures that will be available, and we hope to increase the number of measures very quickly once it's been rolled out. So I'm going to stop there and see if there are questions related to this approach, to the version 3 data, to the quality of the data, anything else that I could potentially answer for you. No questions at all? All right. Well, thank you very much for joining. If you will be joining us for the V3 implementation meeting next week, please travel safe. We look forward to being with you for the first half of next week. And please tune in to the next public and state training. We'd love to have you back and continue to improve your understanding of the NEMSIS standard. Thank you very much.
Thank you, guys.